Let's see about ampicillin. So ampicillin, it comes under broad spectrum antibiotics. So it acts against both the gram positive and gram negative organisms, including streptococci, meningococci, pneumococci, H. influenzae, E. coli, proteus, salmonella, shigella and klebsiella are sensitive, and many strains are now resistant for ampicillin. So mainly ampicillin is an antibiotic, and antibiotics are used for to treat bacterial infections. So ampicillin, well absorbed orally, food interferes with its absorption, and it is excreted mainly through the kidneys. So that's why we give injection most commonly. And uses, first one is respiratory tract infections like bronchitis, sinusitis and otitis media respond to ampicillin, and urinary tract infections, though ampicillin was the drug of choice earlier, many organisms have now become resistant. So urinary tract infections may also treated by this ampicillin, and meningitis. Ampicillin is given with a cephalosporin group of drugs. And typhoid, ampicillin is an alternative to ciprofloxacin, is very important. And septicemia due to gram negative organisms, intravenous ampicillin may be used with an aminoglycoside. And dental infection, ampicillin is useful in the treatment of most orodental infections, however diarrhea has limited its use. And the mechanism of action, it is a broad spectrum penicillin and interferes with bacterial cell wall synthesis during active replication, so causing bactericidal activity against susceptible organisms. So alternative to amoxicillin when unable to take medication orally. So the mechanism of action of ampicillin, mainly it interferes with the bacterial cell wall. It is very important. And the absorption, the peak plasma time is 1 to 2 hours if it takes orally, and bioavailability is 30 to 40%, and in distribution, protein bound type of drugs and 15 to 25%, and blisters and tissue fluid, bile and CSF with inflamed meninges. So the metabolism of ampicillin occur at liver, and elimination of the ampicillin is through the kidney, and its half-life is 1 to 1.8 hours. Normal renal function is 7. So the metabolism occur in liver, and elimination is through the kidney. And the dosage, the most commonly available in the form of capsules, that is 250 milligram and 500 milligram, and the oral suspension, that is 125 milligram per 5 ml and 250 milligram per 5 ml. The powder for injection is 125 milligram, 250 milligram, 500 milligram, 1 gram, 2 gram and 10 grams. These are the dosages are available for injections. And general dosing guidelines are, normally we give 250 to 500 milligram per 6 hours. If we use injection, that is IV or IM, 1 to 2 gram per 4 to 6 hours. And most commonly, the ampicillin dosage is not to exceed 12 gram per day. Is very important. So not to exceed 12 gram per day. And pregnancy category, it is ampicillin comes under category B, that is may be acceptable. And in lactation, definitely it is excreted through the breast milk, so we have to use with caution. So pregnancy category, it comes under B, and lactation, it is used with caution. And adverse effect, the main adverse reaction is diarrhea due to irritation of the gut by the unabsorbed drug is the most common adverse effect of the ampicillin, and also skin rashes are also fairly frequent. So the diarrhea and skin rashes occur by the using of ampicillin. And what are the drug interactions? So mainly the ampicillin interact with vitamins and probenicid. So if we use with along with probenicid, it cause more severe diarrhea, and allopurinol, it most cause risk at skin rashes.